everyone. Welcome to Disruptive Dental Science. I'm Clinical Ambassador for Dental Advisor, Dr. Matthew Miller. Joining me today is another Clinical Ambassador for Dental Advisor, Dr. Ashton Prince.
Nice to be here with you, Matthew. Always fun to do this
Absolutely.
kind of stuff and to be with you.
I think this is one of my favorite things we do. And I love hanging out with you in person, virtually, but I love our interactions. I love what you bring to the table for Dental Advisor. Being partners with you as an ambassador is a lot of fun. So, ready
Well,
to
thank you.
kick off today. We're going to talk about high strength glass ceramics, some new technology we're seeing in the market. Lithium disilicate is not a new material, but it's getting revolutionized in that it's becoming more efficient in its manufacturing process, stronger, better mechanical properties to go along with its exceptional aesthetics. And then we'll talk about your experience with that and some specific blocks that you've tried and are using. And from there, we'll kind of talk about how you then deliver it to the patient and kind of how it's shaped your dentistry, if that sounds good to you.
Sounds fantastic. I like being on this side of the interview
Yeah,
process. This is actually very, very fun for me. So
good.
I will let you
Awesome.
lead the way, brother.
All right, perfect. Okay. Well, so I mean, there's been a big pivotal shift with milling and printing. And we all know printing is exciting. It's been in a lot of different industries, but it's been slowly adapted into dental, where when I say slowly, it's not that it's so new, but it's just we're not quite there yet with certain long-term definitive restorations as we are
Right.
compared to milled restoration. So you're still milling in your office, right?
I am. As intriguing as the idea is to be printing things off in our offices, it sounds fantastic. It may be fantastic. In my personal opinion, we're just not quite there yet with the predictability of the materials themselves. So I have been milling in my office now for the past, it's been about 8 years now. I've jumped back and forth to a number of different systems, but the ability to have a definitive restoration right then and there for the patients and same day dentistry has really made a big change in my practice.
I agree. I historically have milled for years. We have a large practice and we were getting a big bottleneck issue, where we're kind of really had to schedule correctly when it came to, the mill part and then the firing and things like that. So
Sure.
before we jump into kind of materials and stuff, tell me a little bit about, you know, the benefits of doing milling in office, whether it's, quicker turnaround time for your patients, that's obvious, right?
Right.
But I feel like we can be more conservative with our prep designs and as dentists by being able to offer an in-office restoration. And, if we can do these newer techniques and newer materials that allow us to do it more quickly than it used to be like a 2 hour appointment.
Sure. The things that we used to do, the amount of reduction we had to make for a tooth, if we were doing, say, a PFM, or even a zirconia in the past of things, any of those situations, and we were 1.5 millimeters of reduction, sometimes even two, depending on what the situation entailed. I still love gold. That was the one that we had to minimize the very most because it was just so fantastic. But as soon as I started to have an opportunity where I no longer had to try and, let's say, do an onlay or a crown lay or however it is that you want to term those, or even a little bit more of a definitive inlay that you just needed a little bit better strength out of the materials. Trying to temporize something like that and send that off to a lab and have something coming back to you in a couple of weeks, it just never worked. Those things would pop right off again. I didn't want to try and even put a little dot of composite to try and help hold or bond that thing in, even in a small little dot. I would tell myself that it would be a lot easier to get off. Let's be honest, that was a terrible situation. Then I'd have to reduce it back down again to try and get that to still fit for that indirect restoration that I had. It was just one thing after the other that it created more time, chair time, and more anxiety for me of just hoping and praying that when a restoration came back that this would actually fit. It was just too much to have to deal with. So to be able to do all of this now immediately, to cut my preparation at a minimized reduction from what we had to, because the materials are getting better and better as we go, then I could finalize the entire situation right then and there without having to deal with all the temporization that would go on.
On average, what would you say your mill time and firing time would be?
Well, depending on the materials that you're using, I mean, zirconias, then you're maybe milling for 10 to 12 minutes for a single restoration. Your firing time on that one, I've got the CEREC system myself. I've got a prime scan and all that fun kind of stuff from
Mhm.
Dentsply. Um, trying to center something like that, and you're about 18-ish minutes,
Hmm.
18, 19
Hmm.
minutes. So time from start to finish with in between polishing and all that kind of stuff, you're 35 minutes or so, 40
Hmm.
minutes. If you're doing something like an Emax, you're getting pretty close to about the same because you'd still have to crystallize the material as well. So when you're trying to schedule a patient like this, I mean, the amount of time that I take to actually prepare a tooth, I mean, 7, 8 minutes, maybe, at a long term, maybe 10. But then to tell a patient, kick back and relax for the next 45 minutes until we get this thing restored for you. As funny as it is, we've got patients that are now having this expectation of everything has to be so fast. You've got to fly through the process. I want to get out of this office as fast as I possibly can. Granted, if you temporize them, you can get them out faster, but then you have to see them again.
Yeah,
So there is a give and take to both
sure.
ways, but I would say that the thing that's been the biggest benefit to me is not having to see somebody back in a couple of weeks and trying to get
Yeah,
them to schedule back and everything else that can
yeah,
be with that. And I no longer have the control of what actually occurs within the lab process. Now I actually know
right,
exactly what's going to be uh, bonded or luted or whatever we're going to be
right.
doing.
And we haven't really talked about that. I'm sure we'll get into it later, but control is a huge thing because I think a lot of people take for granted, that the lab is treating the ceramic correctly and appropriately, and that's not always the case, or maybe it gets contaminated during the shipping process.
Absolutely.
And so we can maximize the highest benefits of those adhesive bond strengths when we're doing it in real time. Um, and I know not all blocks have to be fired, right?
Correct.
And so would you say that that's where we've seen some of the technology gravitate towards, like these uh, higher filled particles or more densely packed particles within the material, and then subsequently you don't have to fire them? What's the legitimacy of that? Are you seeing that
The I
successful or not?
I've seen it in the past that was not successful, to be very
Same,
genuine with you.
same.
There were a number of materials that were out there that it was a great idea. You're saving yourself 20 minutes worth of a sintering process or crystallizing process, and it sounds fantastic, but a lot of the times the strengths were just not what we needed those to be.
Hmm.
Um, but I had a little bit of an issue for a while with certain products, and so I actually stopped using them for a bit because I just didn't trust them.
Sure.
Now, I tell patients I'm not going to put anything in your mouth I wouldn't put into my own. And so if this is something that I actually have some confidence in, then by all means, let's do it.
Hmm.
So it is trending that way because of the convenience and again because of the time saving and the ability to have patients feeling like they're maximizing their own time as well.
Hmm.
But we've been kind of sitting back and waiting for materials to improve well enough that if we are going to say that these are pre-crystallized materials, well, by all means, we actually have something that you can find some confidence in.
So just like anything, there's some that you know talk the talk and walk the walk, and others that don't, right?
Sure.
Is there a manufacturer or a block that you really like, that you believe in, and that you find that you actually don't have to fire it and you're getting good results? Do you have one that is your go-to?
I do, and I've been using it now for a number of years. It's the GC America's LiSi Block that I've been using now for a number of years. And I, as funny as the first few times that I used it, I thought, this can't be what it actually claims to be. The reduction's actually gotten better and better. Now it's seven
Really?
tenths of a millimeter reduction.
Really?
Beforehand, it was about 1.5
Mm-hmm.
just to get. And I did for the first little bit. I almost over reduced the tooth because I just
Sure.
thought if I get a little bit more, maybe that'll make this a little stronger. So, Matthew, you and I both know that as clinical ambassadors, we love to test the limitations as to what these materials can actually do that we get all
Always.
the time, which is so
Yeah.
fun to do. But at the same time, if it's now going into my patient's mouth,
Yeah.
well, now am I a little bit more hesitant about this?
Mm-hmm.
So obviously, the first one I ever tried it out on was a family member. And as we all know, as we work on family members, nothing ever works out.
Never.
However, in this situation, it did. And it did
Okay.
with some consistency to it as well. So I am starting to gain a lot of confidence in these LiSi blocks and following the process of I'm not centering these things or crystallizing these things at all.
Well, that's awesome. So they have unique technology, and a lot of people think a lot of people don't use the term lithium disilicate. I mean, a lot
Right.
we do, and a lot of other dentists do, but many people just in the market and in the industry just say Emax. They'll ask for Emax from the lab, not realizing that it's a version and brand of lithium disilicate. And LiSi has been around for a while, and it's gotten a lot of traction as well. But they have this unique high density micronization of the particle that
Correct.
and tell me more about that. From what I know, it's just a really tightly packed particle. into the substrate so that you can get better mechanical properties, optimized aesthetics, and you really don't have to fire it because it's the crystallization isn't really adding much to the strength of the restoration.
It's so the way that it actually works, that HDM that they actually have associated with all this, the intent behind it is to have little pre-crystallized pieces that are a part of the entire
Okay.
framework itself. So you don't get all the monomer junk. You don't get all the excess material that is actually going to be within these. So it's actually a smoother cut. It's a smoother polishing. The strength of it is actually much better than what we've seen in previous materials like this that are going through that crystallization process as well. And it also keeps it from, if you were going to be going through and doing some staining and glazing and things, let's say you're firing it afterwards, you're not getting the shrinkage that you would naturally get otherwise, like you would with those other materials that we've had to crystallize otherwise.
So my experience in this is obviously when you mill, you've got issues with, surface texture
Mhm.
and firing. You got issues with shrinkage, especially if you're doing an onlay or an inlay or something like that.
Sure.
It's a little bit easier to manage with a crown because just getting the block out in there, but still you have issues with shrinkage, which leads to marginal gaps. So you're
Absolutely.
saying, you're getting better, smoother restorations, more accurate margins, and stronger.
And stronger. So the margins themselves are a little bit better off. In fact, I remember talking to a representative of one of the, I'll call them the other companies for the moment, that actually came in, and I asked him, if I do crystallize this material, how much shrinkage are we actually going to have with
Yeah.
this? And he said, oh, it's just a small space, nothing you have to worry about. I thought, no, that's not the answer that I actually wanted to hear out of this. He said, oh, but the cement, you're bonding, it'll take care of the rest. I want to hit my head on the wall because that's just not the way that this goes.
Yeah.
So I've always kind of wondered, well, how many straws does it take until the camel's back finally
Yeah.
breaks, or how many corners can you finally cut until you actually maintain a failure that goes on? In a situation like this, if I can get the marginal adaptation better off, that to me is going to be one of the immediate precursors to having a failed restoration. Whether it be from the bonding, or it's just not stable underneath, or we're trying to fill in the gaps and grooves of things. I lose a lot of faith when we start to have materials like that have these big open gaps. Even though they say it's microns, I don't care. A couple of
Yeah.
microns to me is a massive Grand Canyon gap.
Well, it causes critical failure for the cement. I mean, the whole philosophy and principles of adhesion and bonding are predicated on isolation and good fitting restorations and sealing and,
Absolutely.
filling in those areas. All right, so I'm what I'm hearing is it's a better restoration that you can go thinner, stronger, less chair time for the patient because you're not
Less
having to
chair
fire
time,
it.
don't have to fire, don't have to
You can be
crystallize it.
super conservative because you're not worried about, because you can adhesively bond it, so retention really isn't the issue here.
Correct.
Um, so is there a
It's
disadvantage?
it's kind of sounding like everything's a win out of this, right?
Yeah, yeah,
So I'll be
yeah.
very upfront and honest with you. The aesthetics on it for the first
Mhm.
little bit are just a little bit on the lacking side. Now, from GC, they are improving that here
Okay.
very quickly to get some different shades and things, but they do have these blocks currently in an A1, A2, A3, A35, and then a B1, and then a bleach shade. And they are going to be expanding out onto what those colors are actually going to be. But there's a high translucency block and there's a low translucency block,
Okay.
depending on what you're trying to actually hide, or where you're trying to use these. Now, in anything that I ever do in my office, I will always dictate what material do I want to use in an area for a particular tooth, and then I use that as my grounds or my basis to what is my procedure going to entail. How much do I have to reduce? What do I have to hide? What do I not have to hide? What am I trying to build back up? How much of a video am I starting to try and re-maintain? Right? Anything along those lines. Everything for me is based off of what do I need my material to do.
Of course.
Now,
Yeah.
when we're starting to talk inlays, onlays, crowns, I will say that I've been very hesitant to use a material like this back in the posterior. I do use it mostly for bicuspids, occasionally in the anterior when I'm going to start doing some staining and glazing and things like that. But a lot of the times, even just simple polishing of this material actually does a very nice job. Um, but over some time, then I've actually started to use it a little bit more on the crowns. But when it comes to onlays and inlays, this is going to be my constant go-to. It is easy, it is efficient, it is time saving, it is predictable, it's phenomenal when you try and get these things on.
Nice. So to that point, I have two follow-up questions on that. One,
Perfect.
you know
Number
me.
one.
Well, number one. Uh, there are some gradient blocks out there, and there's some pros and cons to those, right? With some aesthetics and mechanical properties, and
Sure.
where you put your restoration, where you place it digitally into the block so that you can maximize the color gradient. Is
Yep.
that something that GC is exploring?
I would dare say in something like this, I can't talk for GC
Sure.
directly as to what they actually have with things, but I'd say from what the previous blocks have been, not really. It seems to be a
Okay.
pretty um, monochromatic style of a block. I mean, there's
Mhm.
not a lot of variance to it, but that doesn't mean that you can't use your stains to
Yeah.
be able to just fine tune just these last little bits and things that you've actually got. So luster paste or things like that that you can actually use, or they're great for something like this.
And my second question is, for those people who say, "Well, I don't want to be my own lab tech," you know what I mean? It sounds like you're not. I mean,
Oh,
because I remember back when I had milled for years, years, and I was doing the custom staining, the custom glazing, and you kind of get to a point where it's like, you train your team to do that and
sure.
you're doing it. But there are certain cases where it's so many units, and you think, I really don't want to have to do that. But you're in this situation, the aesthetics are still good just to polish and go,
Sure.
depending on what the aesthetic demands and the goals of the case are, right? But for
Correct.
if you're doing inlays, onlays, and if you're doing some interior work, the aesthetics are still there, right? I mean, you're not really doesn't sound like you're spending a lot of time customizing chair side, then reglazing, then doing more customization, then reglazing and things like that.
I would dare say I'm only staining or glazing or things like that, maybe 3 to 5% of the time. Everything
Oh
else is
wow.
just a simple polish and you're done. Now you're exactly right, Matthew. When you start talking about what are the aesthetic demands of that particular case, a lot of the times if I'm doing, let's say, just as an easy answer of a 6 unit canine to canine veneer case or a 3/4 crown case or whatever you want to have for those, more often than not, the demands are really, really quite high. So
Mm-hmm.
I'm having a layered restoration that's actually going to be utilized in areas like that. So
That's fair.
I I use these in single unit cases where the demands aren't nearly as high. Could I,
Mm-hmm.
with a little bit of some added time and all of my glazings and stainings and things? Absolutely, yeah, I could.
Yeah.
Do I want to be my own lab tech? No, I really don't. But I love the phrasing behind it because it makes us seem like, oh, it's going to be so much more time to try and make this happen. It's really not that bad.
Yeah.
So
Yeah.
my associate that I've got there in my office, he just did it was a 20 unit case, anterior case, and he used these LiSi blocks for every single restoration.
Wow.
Um, Prepared the teeth one day and then spent the next day actually becoming his own lab technician.
Sure.
But he wanted to kind of see as to what he could actually end up doing with this. And what he thought was going to take him anywhere from 6 to 8 hours of working with these things actually took him about an hour and a half. And he had
Whoa.
all 20 of those things done. Uh, because when you start trying to fire those, I mean, you're not spending all the individual time with it. I mean, he was doing multiples all at once, and
Right.
in sincerity, things that went a lot faster for him. The demand of the case, he was a younger guy. He was in his early 20s. The history on him was a little
Mm-hmm.
saddening, to be honest with you, as to the history as to why he was in this position. But as soon as the restorations went on, they were beautiful. They seated
Yeah.
perfectly. The margins were not an issue. The aesthetics were there, and the amount of time that took him was about an hour and a half after it
It's
was all
amazing.
said and done. So it was phenomenal. He loved it, and so I asked my associate if he'd actually ever do it again, and he kind of hinted a little bit of, yeah, probably I will, but I might have one of the assistants do that instead for me in the future.
Sure.
I said I can understand that, but at the same time, he was able to do it in a very timely fashion.
That's awesome. And for back when we'd always have to fire and center things and we'd have to glaze it.
Right.
You could run into some trouble with glaze, like having glaze pooling or, getting some more sort of contaminant in the glaze and things like that. And that can be kind of a problem. So I think that right there alone, if you can just polish and go, is a
Polish
big
and
deal.
go. It
Do
is.
you do you find that certain polishers work better for this material, or do you have do you have to be careful in your polisher selection other than using something that you would typically use for high strength glass ceramic?
It's the exact same things that I've used in the past. I mean, there isn't really anything that I found that was just absolutely phenomenal to try and polish these things up. So you're initially maybe a diamond burr to cut a little bit of some detail out of it if you really wanted to get some tertiary anatomy out of this kind of stuff. You
Hmm.
can do that stuff. I'm a little hesitant to take a diamond or a carbide to the materials just
Yeah,
because it just always has made me a little bit nervous. But the
sure.
same polishers that you've ever used for any of your glass ceramics will work beautifully on these.
Nice.
Um, I have I have heard that there are certain companies that are looking towards bringing in a polishing set that is designed exactly for these blocks as well. I don't know where they might be in the process of that. So that is a little bit of some hearsay. But at the same
Mm.
time, if they do bring that kind of stuff out, then there'll be a very specific dynamic for it. But as of right now, from everything that I've ever used, whether it was me trying to polish off a zirconia or polish off an Emax or polish whatever I've been actually utilizing and using, it's worked beautifully for this as well.
Nice. And polished ceramic does wear very well because we all know that glaze dulls over time and it wears. So if you have a rough undersurface, that could be more abrasive to the opposing dentition. So actually, as I think about it, having a non-polished or non-glazed surface, but having a highly polished surface could
Mhm.
do really, really well, not just for the restoration, but for the opposing teeth.
For the opposing teeth as
Have
well.
you
Yep.
seen that this polishes up? Because sometimes when you adjust ceramic, you get back from the lab, it doesn't always polish back up the way we like it to. Do you
Right.
find that this polishes easily and efficiently?
Polishes beautifully. You do start to get that glass appearance to it. With anything that I've ever printed off or that I've ever milled out or anything along those lines, the amount of time that I usually have had to take with different materials is you got to get that. It's almost a dirty appearance to it when it first
Mm-hmm.
comes out. You have to clean
Yeah.
it off a little bit, and then you have to go back and use your goat wheel or something, and hoping that you're going to get that final
Yeah.
little luster that you get out of it. You do. You absolutely can gain that back again after making any little adjustments. So process for me. It'll mill out. I'll take off the sprue that I've actually got there. I'll try it into the mouth and make sure that everything is mechanically working as to where it should be. Margins are right, contacts are right, occlusions right. And more often than not, with the way that materials are these days, there's no questions whatsoever. It's exactly as I had it designed. Take it back, and I don't have to put a lot of pressure. I don't have to really. It was a concern for me if I start to polish this, is my contact going to be gone afterwards? So you'd have to kind of push and kind of hard to try
Yeah.
and get that to look the way that you want it to look. Well, with
Right.
this, you don't have to push very hard. It's just a nice light pressure that goes across
Nice.
that, and it really does start to give you that appearance back as to what you're looking for.
That's a good point you bring up. That's certainly been an experience for myself, and I'm sure a lot of clinicians like us that you had to really polish a lot on ceramics, and then you would
Oh,
kind of lose that contact point because you had to polish to get it to where it needed to be.
sure.
So yeah, that's really good to
But
hear.
it's fun to be able to see again what these materials can do. When you start talking the actual strength of the material as well, anyway. I had a lengthy conversation with a number of colleagues a couple of months ago at one of the conferences I was to, of how much strength do you honestly need out of these materials that you're actually utilizing in the first
Yeah.
place. Now we hear zirconia, oh, you're getting 1,200 megapascal, you're getting 1,000, you're getting 1,400. They're fantastic. They're never going to break. You can run them over with a car, hit it with a hammer. Great. Who cares? I don't really need that much. I just need it to be a little bit better off than enamel. And you are going to be better off with something like this. And where these LiSi blocks come in is a little bit stronger than what the enamel is anyway. In fact, it's about, if I remember right, about 10 to 15% stronger than what the enamel strengths are. So when you start asking yourself, what do you need your materials to do? Well, in a case like this, I need it to function because of that minimized reduction that I can actually do with these things. I'm trying to mimic nature as much as I possibly can. So I'm not going super thick on these things. And
Mhm.
this actually does have that glass-like appearance with the high translucency blocks, and that's usually what I'm using a lot when I'm doing my on laser, in laser, things like that. I'll use the low translucency when I'm doing actual crowns,
Yeah.
but they really do. They work very very nicely.
Well, and to your point, the more tooth structure we can conserve, the better the
The
restoration, the better this
better
overall success is
everything
for the tooth.
is.
Yeah, it's just better all the way
Absolutely.
around.
Yep.
So so shifting gears a little bit,
Yeah.
we've talked a lot about the substrate and the blocks. Now we need to go to cement, right? Now we all know how to cement glass ceramic, but some companies in recent years have made a big pivotal shift in doing, using universal materials for their bonding agents, for their cements. And in the
Sure.
past, and you and I teach on this kind of stuff, and so we talk about this regularly. But in the past, universals were kind of a misnomer where they would say, "Well, you could use it for the anterior, posterior," but it really wasn't universal. And now we have universal materials that actually have built-in primers.
Right.
It's not just a generic that we're going to get compromised bond strengths with. We're actually getting superior outcomes and you can use them with whatever technique you prefer, which adds to the universal kind of nature of the product.
Sure.
So, we both have busy practices. We both have, we both wear several hats, beyond just being a dentist, whether it's writing, clinical trials, teaching, things like that, we working with the dental advisor and other manufacturers and just being, have our personal lives with our family. So, for me, I like to be efficient and I don't like a lot of frustration, a lot of headaches, and I want predictable results. And as
Amen.
do you. So let's talk a little bit about that. So when you've got your block, you've done a great restoration, you've got a great polish and a great margin. How are you got to treat it right? You got to acid etch it, like just like anything else.
Right.
Then what are you doing? Are you priming it? What are you doing to the tooth? What's your go-to steps going forward?
Regarding this particular material, I'm kind of the advocate of I like to keep things in-house regarding the actual family itself of the material. So if I have a GC restoration or GC block or whatever it be, I like to try and stay into the same role of what their adhesive properties are or what their materials are as well. So the material that I use for these pretty exclusively actually is their GSEM ONE. Now, the process, you take a LiSi block, the manufacturer's suggestion on these is that you will hit it with some hydrofluoric acid for about 20 seconds and rinse that off. And they use a multi-prime that GC has come out with as well that is just going to help silinate the actual interior of this entire thing. It gets it nice and prepared for you to be able to start now talking about doing this cementing or bonding dynamic to it. So GSEM ONE. Reason I like this is that it's a dual cure. I mean, you can light cure it, you can let it self cure, you can go either route. For me personally, the reason as to why I like that kind of stuff is if there's somewhere that my light, and we could talk for hours, Matthew, you and I, about whether the light works or where it doesn't, and is it strong enough, is it not strong enough, is the battery, I mean, we could go off forever on that kind of stuff. So I like to know that there is a material out there that is going to take care of the areas that I can't hit sufficiently or efficiently with my light. And GSEM ONE is one of those. Okay? Now, within Dental Advisor and the evaluations we've been able to do, GC has come out with something called an AEP, an adhesive enhancing primer that we actually use for this, that you will apply onto the tooth. And it is literally just take a brush, put it over the top of the entire thing. If you want to etch it first, great. If you don't want to etch it first, whatever you want to do with it. But you apply it on there. I let it sit for a few seconds, usually about up to 10, then just dry that off, apply my GSEM ONE onto the inside of the restoration, pop that thing on. And for me personally, I'll clean off a little excess if I need to. Or you just let it sit there, or you can tack cure it for a second. You can do whatever you want to with this material, and it seems to be working and cleaning up very, very nicely. The intent of the way that I go about it is I'll let it sit for about a minute or so and just let the tooth adapt to the material before I light cure it.
Okay.
Now, granted, could I tack cure it? Yeah, but if this is going to be a dual action situation that's going on to it, I kind of like for the tooth to just get acclimated to use of the material being in there and let it do whatever bonding it's going to do to the tooth naturally anyway. And then after I've let it sit and I feel pretty confident with it, then I'll still go back and I'll light cure it anyway, just to make sure that I get as much strength out of that material as I possibly can. But what's funny about this, even though you don't necessarily have to use the AEP with it when you're cementing these, because you could just apply that GSEM ONE and go about your day and you're done with it, I've actually found that using the AEP gives me the type of strength that I would be doing if I was doing a traditional bonding, with a purely light cured system, and it's working very, very nicely. I'm getting all the strength that I would get otherwise.
Nice. And, being a universal, you can use it with universal bonding agents. They've got their G Premium
Anything.
bond, kind of versatile in that regard. And you could really, I mean, if you're, not keeping it in-house as you described, you can certainly, it's compatible with other manufacturers' bonding agents if you so choose. One of the things I like about that AEP that you talked about is that there's no film thickness to it.
At all.
Now,
Yeah, you're
yeah.
exactly right.
And now when I've used it, I've not etched prior to it. I just put the primer on the AEP. And because we did independent research in Dental Advisor, and for those listening in on this podcast, you can go online to the Dental Advisor's website and find that data. And it was pretty astounding. Let's touch on that for a second. The data that Matt Cowan had in the lab was just off the chart with especially when you use the AEP primer.
Yeah.
Um, um, I don't mean to sound redundant, AEP primer, but the AEP. Uh, and it was not just initial bond strengths; it's long-term thermal cycled advanced aging bond strengths, and so that's pretty remarkable with both glass ceramic and zirconia, right,
It was.
and
Yep.
metal and things like that. So I think that right there is pretty profound. The 1 second tack cure can be a little bit of an adjustment for people to get used to, especially if you're curing for. Because a lot of curing lights have a tack mode, but it's usually a 2 second tack mode, and you're doing it from the buckle. Let's say it's 1 second, you're doing it from the buckle, then you go to the lingual, you're hitting that other side again. So the cleanup can be a little bit of a learning curve to get used to. At
Yep.
least for me, that was my experience. But then, like you said, if you let it set up a little bit, it's you know
It's a lot easier to clean up. And once
yeah,
you've got it cleaned up, then with all the confidence in the world, go ahead and
right,
cure the snot out of that thing. Whatever you want to do with it,
yeah.
you're going to be in great shape.
Yeah, I do like to like cure resins and resin cements just from a yielding a higher bond strength in that regard. For me
Yep.
anyway. It comes in several different colors. We've got like the clear
There is.
A2, bleach
There's
white,
clear,
something.
translucent. There's an A2. There's an opaquer style. I mean, there's a number of them that you can actually utilize and choose. But again, when it comes to this, if you're allowing for the cement to dictate the actual color of the restoration that you're using,
Right.
you're going to be pretty thin.
Yeah,
The
it's
vast
very thin.
majority that I'm using is going to either be translucent or it's going to be the A2. And
Mhm.
those are really the only two that I have to go after. If I'm trying to use an opaquer on these things, I'm probably using the wrong block or at least the wrong thickness of what I'm trying to actually utilize out of these things. So the translucent and the A2 are the ones that I use more often than anything else.
I found that because you and I, we worked with the dental advisor doing research study on this and
Mhm.
used it quite a lot. And I used all three. I tended to gravitate to the A2 and then the white opaque. From a value standpoint, you're absolutely right. The cement layer is so thin,
Yeah.
and if that's what's changing the color, true color, right? Um, your hue, and if it's changing your chroma, that again, you got to start thinking about the substrate and maybe your shade selection and stuff like that. Where I
Exactly.
find that it's helpful is just in the value, you
Yeah,
know,
that's fair.
and just kind of turning the value up a little bit or keeping it neutral with that A2, kind of a neutral dent and shade.
Yeah.
So, you know, talking about this AEP, and you could use G Premium, you can use bonding agent, you can use whatever adhesive modality you want, whether it's self-adhesive or adhesive. And that's what I like about a lot of these companies who are coming out with these universal systems that you can take a self-adhesive situation and have an adhesive protocol. Or if you are concerned, and again, we could talk for hours on light curing principles. If you're concerned about light polymerization, the fact that you can have something that's going to auto polymerize is phenomenal, right?
I
There's
love it.
no guessing.
Uh,
GC kind of coins this term touch cure technology,
mhm.
right? And that is in conjunction with the primer. Let's talk about that for a second. We've already talked about the AEP and how it's enhancing bond strengths and how you use it. You mentioned you can etch beforehand or not. I've not used it in etch mode. I've just put it on the tooth
Sure.
for a couple seconds or like 5 to 10 seconds, then air dried it, and that's all you have to do. Now, this touch cure technology, from what I'm understanding, is that simply kind of more like a catalyst, right? The primer acts like a catalyst for the cement, and it cures towards the tooth. Am I correct in understanding that?
It does, and you're exactly right, Matthew. When you start talking about what the acronym, the AEP actually stands
Mhm.
for, the E is enhancing. It's an enhancement process that actually goes on to this. So you would apply that primer, that AEP primer, down onto the tooth, and as soon as the GSEM one interacts with that material, it starts to almost instantaneously set up a lot faster in its self-curing mode than it would be if you were trying to hit it with a light. So it does cure towards the tooth, which is something I love that it does, as opposed to pulling away from it or trying to. I, for me personally, I swear that most bonding agents will start to dehydrate a tooth. This will actually go towards it. It's something that I've actually had to be a little cautious with because if I do
Mhm.
have the AEP onto it, I really feel like if I'm going to be putting this restoration on, I don't have a lot of working time to be, messing around with it. Granted, you got a minute or so is what the claim is, but for me, if I know that it's going to start interacting very quickly, I want that thing to be down fast and efficiently because otherwise it might start to set in ways I don't want it to, or it might start to break some of those bonds that we actually have as I try and force it down a little bit harder. So it works very, very well. But for me personally, you do need to be just a little cautious with it. But when you do use it the right way, It's not like it's an extra step or something you need to be scared of. It's just something that you need to be aware of. And there's a difference there.
Yeah, you're right. And then just being aware of it, it's not like you have to work in warp speed. There's no film thickness to it, so you're not worried about that. And for my thoughts of like, why wouldn't I use it?
Yeah.
With what the data we saw in the lab, like why if I'm going to use this cement system, why would I not take like and the time my assistant is filling the crown with cement, I can put that on there, dry it, and then go to just put it in. Now
You're ready to
you're right.
go.
If you're cementing multiple units at a time and you're kind of shimming things and kind of shifting, that's where you can run into trouble.
Right.
Absolutely. And I'm not sure that would work out well for everybody. But once you get the hang of it, it's just again, it's just simple, and you've
Everything
got
that you're
time.
doing,
It's not like a light switch. It's not instantaneous.
everything that you're doing in dentistry is how confident are you in the materials that you're actually using? How familiar are you with the way that you're actually going? So in a case like this, let's say that I was doing a 6 unit anterior case, am I priming all 6 teeth at once? No, I'll do 2 teeth, and then I'll go to the next 2 teeth, and then I'll go to the next 2 teeth. Have I tried them in and everything else beforehand to make sure that they fit? Yeah. And then I've got a lot of confidence, like you said, Matthew, that that film thickness is basically zero. I mean, it's so thin on it that I can apply this stuff and I have to worry about, will that just dislodge the try-in that I just had? No, it doesn't really at all. So if you know how your materials work and you know what protocols and systems to be implementing and to be training your team on, then the anxiety's gone out of what
Yeah.
you're actually doing.
So you're saying you don't like to get residual set cement on adjacent preps before you put your
I don't.
restorations on.
Personally, I don't. As weird as that is, who would have guessed that would be the case? But
I
no,
know.
I like for it to actually fit the second time as well.
Ah,
But
nice. What about shade stability, color stability? Because a lot of dual curing resins do have a reputation for changing their color after they cure
yep,
and over time as they age.
yep. And
What's been your experience with that?
as we say that what those dual cures have been doing in the past, usually they don't get brighter; they're getting darker.
Mhm.
Is the biggest issue to it. And then we start to see some marginal discrepancies that go on to it that really start to tick off these high aesthetically demanded people. Um, in my case, we did amongst Dental Advisor again during this evaluation that we had. I believe by the time the evaluation was done, I think I saw about 112 restorations that were done between you and I and others. Um, the amount of change that I saw over a 2 year period of time, maybe one, maybe two that had some
Yeah.
small little discrepancies, and they weren't even dramatic to start off with in the first place.
Mhm.
But the vast majority of them all maintained that same color they had when I first seeded those restorations in the first place.
Yeah. Yeah, there are some companies who do a great job with color stability, whether it's they don't have a tertiary amine as the catalyst, or
Sure.
maybe they have some other proprietary, you know, catalyst or chemistry to the material. So some do a really great job, and others, unfortunately, don't. And they can have a good cement, but maybe it's just maybe not the right choice for that
Sure.
aesthetic situation. And we've kind of touched on this a little bit. If your cement is really making that big of a difference, then more often than not, your light can penetrate. If you have a high
Yeah.
power curing light, it should be able to penetrate that. So in those situations, if you're really worried about color stability, then chances are that a light cure cement is going to be your better option in that regard. But having a dual cure that is strong, that cures towards the tooth, that is color stable, is a huge advantage.
Knowing your materials, how they're going to react, how they're going to
Yeah.
respond is key to any restorative case that you're doing. And when you're starting to talk about a block that is a little bit more inventive, now granted, the LiSi blocks have been out for a little while,
Mhm.
but if you haven't used these in the past, you need to start implementing these into your protocol lists purely because of the benefits that you're going to actually have. I mean, if we're talking a 40% reduction in time from the milling process to the non having to crystallize process to the ability to bond these things in a dual cure fashion that is really not very technique sensitive in the first place. There's not really anything to be nervous about or scared about when it comes to these products. And so if you haven't utilized them, I really and truly I think that you should give them a try and see what happens with them. You might actually be really, really surprised.
Now, if you're someone who doesn't mill in office, is that something you can request from the lab? Because a lot of people just say Emax or ceramic or whatever. A lot of people don't even get that specific about, the type of ceramic they want.
So
But is
I
this something
kind of,
you can ask for the lab?
yeah, I think you can. Don't know why you wouldn't be milling for something like this if that was the case. I mean, most
Yeah.
people, if they're sending it out, then they are using The traditional has always been just Emax. You know, give me an
Hmm.
Emax, or a lot of the highly aesthetic cases out there are using LiSi press anyway
Yeah.
as they're doing layering process. So it's not like it's familiar that your labs are not, you know, wow, I was going to use a double negative that it was going to be really bad. It's your labs are familiar with the material. There's no
Yeah.
question that they are. So could you
Yeah.
request something like this? I'm sure that you could.
Hmm.
Um, I just never have had to, purely because
Sure.
I enjoy the process and the system that works in my office as well as it does.
Well, it seems like it's really catered and well suited to in-office billing. You know,
Without a
a
question.
lab, you're not really worried about the time it takes the lab unless you have like a really quick turnaround. But
Yep.
you know, and if you're doing the restorations in office, you actually are concerned about chair time. Time is, you know, valuable to the patient. They're taking time away from their day to come see you.
Sure.
Time is important in the office. Time is money. But you also, maybe you don't have a lot of extra rooms where a patient can just sit and hang out. So
Right.
having something that's going to be quick and predictable is very valuable.
I've never heard a patient say I haven't been sitting in this chair long enough. Yeah, it's always what's how fast can you get this done? When I can
Yeah.
present a restoration to somebody, have it bonded into place, and have them out the door, if you start breaking down as to exactly how long something like this actually takes, my scan, a couple of minutes, let's say 3, 4, 5 minutes. You know, I design it for a couple of minutes. I mill it out in 10 to 12 minutes. I don't have to fire it now. I mean, I can have the entire situation done from the initial point of scanning all the way to actually having them walking out the door in about 25 minutes, 22 to
And
25 minutes.
and from an efficiency standpoint, you can train your auxiliaries and your
A
team members
hundred
on
percent.
how to do pretty much all of these steps minus the preparation and all that, right? You can have them involved in the design process. You can approve it. They can do the milling and then the polishing, and you're going to do the final check.
They can do the design, they can do the mill, they can do the polish, they can do the pre-treatment onto the tooth, so that all
Hmm.
that I have to do to walk into it, I can finish prepping a tooth. They will take over the scanning. They'll take everything else to it to the very end of things, so that I can actually just double check that fit one more time. And it's already been pre-treated. All I have to do is just clean out the inside of that thing, and then I'm ready to start bonding my restoration right in. So of that 20 to 25 minutes, how much of that is being done by my team? 90% of it. You
That's
know,
awesome.
it's phenomenal.
That's awesome.
Trying to gain some confidence in your team, train them the right way right out of the gate, and it'll save you so much time in the future.
Yeah. Yeah. That's
And then
fantastic.
trust them.
Well, yes, that's the other part too. But you know, when we talk, and this is neither here nor there, and it's for different discussions. But you know, staffing for every industry, and you know, dentistry is not immune to that. That can be very difficult, and you can have turnover and things of that nature. So having something that's intuitive, easy to do, that's not so technique sensitive, that you know you're not having to glaze it and fire it and get shrinkage and a distorted fit,
Right.
or and then you got to start the process over again. Things like that. Having stuff that's easy to work with is great because there's less of a learning curve, and you can get new or previously untrained employees or team members up to speed quickly, right?
Within the past month, I hired on someone that had just graduated from high school and another one that had just graduated from the assisting style schools, assistant training schools that is local to us. Um, and between the two of them that had really never done any scanning or hadn't done anything really, they were trained on a weekend. And from there on out, when I say that you have to kind of trust them for the first little bit, did I? No, not really, just because I wasn't
Oh,
quite sure. But after the
yeah,
first two or three that they handed to me and they were perfect every single time, I thought, okay, I can let
yeah,
these guys go. So now I don't have to sit there and micromanage everything that goes
yeah.
on, because it is very, very easy to be
It
trained on
is.
these.
That's awesome. I like to use the term trust but verify.
Yes, verify is something that I've had to kind of step back from a little bit. I mean, it's
Yeah.
when it comes to us, Matthew, you and I, we're nerds, and a lot of the people that are out there that are even listening to this and have been sticking along with us for the rest of this, it's you guys are nerds too, and it's okay. You kind of love this kind of stuff. You love to have your hands into something because you actually have a passion for dentistry, and that's fantastic. So to hear that things like this, that you have to kind of give a step of that away to somebody, sometimes that's hard for us to do. But in something like this that is as easy to work with and the predictability is there, this is one of those things that you can let go.
Awesome. Well, I really enjoy our conversation today. I appreciate your time, and it's always great to see you and do these things together and collaborate. So, appreciate everybody listening in, and hope this was insightful. And we wish you all the best in your dental journey. For more information on dental materials, research, independent lab studies, and to go on and learn more about the block designs that we talked about today and the materials, the cements, please go on to www.dentaladvisor.com. On there, you can look at other podcasts and other publications that we've put out. There's a wealth of knowledge in the Dental Advisor that you can explore and learn more about this topic and others. Thanks for joining us.
Thank you very much, Matthew.
I enjoyed it, Dr. Prince. Thank you.
See ya.